Okay, good evening, everyone. I hope you can hear me well and you can see me back here. It's a privilege to be invited to this beautiful webinar by Helion. It's an honor for me to join you and to speak after Dr. Muhammad. His presentation was very beneficial, and I'm sure everyone learned a lot from his wide experience, from his beautiful cases, and from his beautiful explanation as well. Today, I will talk about the pharmacists at the forefront, how eager they are in managing cough. Of course, after having the diagnosis and the right diagnosis from physicians in the UAE that have a very good wide practice in managing patients, especially NT doctors in this area. So I will start talking about an introduction, which is definitely talking a little bit about cough, which is a protective reflex caused when the airway is being irritated or obstructed, as also Dr. Muhammad mentioned. And its purpose or the purpose of the cough is to clear the airway so the breathing can continue normally in our patient. Usually, the majority of cough presenting in the pharmacy are caused by upper respiratory tract infection, and they are associated with other symptoms of a cold. So the most important thing to ask from a pharmacist point of view when we are approached with a patient coming with a cough, the information to collect are crucial. The most important thing is basically the age of the patient. To establish who the patient is it a child or an adult? This will influence, of course, the choice of treatment and whether the referral is necessary for physicians, or we can recommend something on our own. The duration of cough is also important. Like most coughs are self-limiting and will be better with few days with or without treatment. In general, a cough that is lasting longer than 3 weeks duration should be referred to physicians like ENT doctors and so forth. Other important information that are usually requested from the patient is the nature of cough, to know whether it's an unproductive cough or a productive cough. The unproductive cough in nature, of course, is associated with no sputum production, and these type of coughs are viral in nature, caused by viral infection, and are usually self-limiting. The productive ones are chesty or loose cough, which presents with sputum that is produced. Sputum could be color, green, yellow, or rusty in color, such as in bronchitis or pneumonia, and require definitely referral. Sometimes blood may be present in the sputum, like hemoptysis, giving a color ranging from pink to deep red. Non-colored, like a clear or whitish sputum, is uninfected usually, and it's known as mucoid, as all of us know. Now, the problem is in heart failure or patients that have comorbidities or mitral stenosis, the sputum is described as usually pinky and can be, or pinkish, and can be bright red as well. So confirming the symptoms will be breathlessness, or especially in bed or at night, and definitely swollen ankles in patients that present with heart failure or have comorbidities of heart failure. Now, other information to be collected is probably the history of TB, like chronic cough with hemoptysis associated with chronic fever and night sweats. These are classic symptoms. Croup, which is also very crucial, which occurs in infants. And usually parents freak out when they see the child or children coming up or showing up as a croupy type of cough. It develops a day or so after the onset of cold symptoms or cold-like symptoms, and the cough usually has a harsh barking quality and is associated with difficulty in breathing, inspiratory stridor, and definitely referral is necessary to physicians. Other information like a whooping cough, this starts with catarrhal symptoms. It's associated with different characteristics. The characteristics or the characteristic whoop is not present in the early stages of infection, and the whoop is usually the sound produced when breathing in after a paroxysm of boost of coughing. And the bouts of coughing present or prevent normal breathing, and the whoop represents the desperate attempt to get a breath. And this is usually where we say that referral is ultimate and is necessary. What other associated symptoms we look for, like a cold or sore throat, may be associated with the cough, and this is where patients present to us in the pharmacy saying that I have a sore throat, please, I need anything to recover from the sore throat. So this is also a typical symptom that patient present with to the pharmacy. Often there may be a temperature and muscle aches. This would be keeping our eyes open with the presence of a viral infection, and this can be self-limiting. So we go ahead and reassure our patients usually. A chest pain is another issue, like shortness of breath or wheezing is all indication or are all indications for referral usually. So that's why we should ask the patient, do you have any chest pain? Do you have any shortness of breath? Or do you have any wheezing? Post-nasal drip, also as talked or discussed with our previous ENT doctor with us, it's a common cause of cough and may be due to like infections such as sinusitis, for example. Previous history, this is also ultimate and very crucial for us as pharmacists to know the history of the patient and to see if there is any history of chronic bronchitis which is being treated by, for example, an antibiotic. In this situation, further treatment may be possible with an appropriate cough medicine that we can give to the patient, but we need to know the history. Asthma is very important. A recurrent nighttime cough can indicate asthma, especially in children, and this also requires a referral. Cardiovascular disease, cough can be a symptom of heart failure, as discussed previously. Is there a history of heart disease, especially with a persistent cough? Then definitely we should advise the patient to refer to a physician. Gastroesophageal history, like reflex, that can cause a cough as well. Sometimes such reflex is asymptomatic apart from coughing. Certain cough remedies also to remember that are best to be avoided in patients that are diabetic, that are hypertensive, and the patient that have heart disease or cardiovascular illnesses. Smoking habit is crucial, and the smoking usually will exacerbate a cough and can cause coughing since it's an irritant to the lungs. 1 in 3 long-term smokers develop chronic cough, and this is something that we have to ask the patient, do you have a history of coughing, of smoking? How many cigarettes do you smoke per day? So this is a crucial history that we should take from our patients before recommending anything. If coughing is recurrent and persistent, the pharmacist is in a good position to offer health education advice about the benefit of stopping smoking. And this is basically the smoking cessation clinic that we always say that refer the patient to a smoking cessation clinic where with the help of the pharmacist definitely that has or have a wide experience in this aspect, they can help them in smoking cessation at least one step after the other. And also this is something worth discussing. One thing that is important is also to know or to collect information about the present medication, what type of medication the patient is taking. It is essential to establish the type of medication that the patient is taking, the name of the medication. Sometimes you identify those medication with colors. Also, if the patient doesn't remember, sometimes we tell them to bring in all the medication to the pharmacy to figure out what type of medication probably is causing cough to patients. It includes also the ones that are prescription medication and the ones that are given over the counter. It's also very important, as mentioned in the case of my previous colleague, which is the possibility of interaction with cough medicines as well. So this is also the specialty of the pharmacist. A wide range of class of medication that causes cough is going to be the ACE inhibitors. And the chronic cough, typically the cough is irritating from ACE inhibitor, non-productive, it's persistent, that can occur in patients taking ACE, such as enalapril, captopril, particularly in women. So this is basically where question that include, are you taking any ACE inhibitors? Can you tell me the name of the ACE inhibitor? When did you start taking it? How long have you been on it? The problem is now well recognized and patient may develop the cough within days of starting the treatment or after a period of few weeks or even months. So it could be after a month from starting the ACE inhibitor, the patient is suffering from cough. Any ACE may induce cough, and there seem to be little advantage to be gained in changing from one to the other, like from switching to, for example, from lisinopril to captopril. But it's wise enough for the pharmacist to choose to switch, for example, to a like an angiotensin blocker, like valsartan, or switch to another category of medication, of course, after discussion with physicians. That's why discussion with physician, having an open communication lines is crucial to have this treatment plan like well established in our patient. The cough may resolve or may persist in some patients. The cough is very troublesome, very distressing in nature, that, as I said, ACE therapy has to be stopped, although the patient might be doing well, that the systolic blood pressure is controlled, but we have to stop it, unfortunately. Any patient in whom medication is suspected to be the cause of a cough should be referred directly to the doctor, of course, after explanation with the doctor and with the patient as well. So always have the patient engaged in the discussion and the treatment approach. It's also useful to know which cough medicine have been tried already, what the patient has been on before. The pharmacist may decide, for example, that an inappropriate preparation has been taken, for example, a cough suppressant for a productive cough. So probably we can tell the patient that we have to switch you to another product that is more suitable for you, and we have more appropriate remedies that should be tried before trying the one that you are taking. So that's why open discussions with our patients is crucial. Of course, if the cough has not improved after 5 days, the patient should see the doctor. That's why calling up the patient after a few days is also important, to follow up on them and to see if the treatment plan that we recommended for them is beneficial or not. So I didn't waste too much time. I skipped right away to the case study. And this is basically the case number 1, that also are general cases that we face and we encounter in community pharmacies. Of course, this is what we teach our students in our university, how to basically confront a patient with cough and how to deal with them through different type of simulation programs and OSCEs in order for them to be ready when they graduate and to be really students that are very strong and confident as part of the healthcare team. So this is a typical case of a patient with an acute cough that has lasted for less than 3 weeks. It's a 21-year-old man who presents to the local pharmacy with a cough that has been bothering him and has asked to speak to the pharmacist right away. So usually when we have a patient like that, we have to discuss some things with the patient. First, the cough characteristics. When did the cough start? Is the cough dry or productive? Are you producing any type of phlegm? Is there a pattern to the cough, or does it have any triggers? The past or the patient medical history of the patient. How are you feeling? Are you experiencing a fever, a runny nose, or malaise? Do you have any relevant medical condition? Are you taking any medicines? And have you tried any OTC treatment before we jump into a conclusion and we give the wrong therapy? What about the social history is important as well. What do you do for a living? Do you have any pets at home? Have there been any changes to your lifestyle recently? And about the smoking history, including if the patient has given up smoking recently, what type of tobacco, or how many did you smoke a day, or how long have you smoked for? Social history also concerning the alcohol use or recreational drug use as well. So this is a full history before we go ahead and recommend anything for our precious patients. On answering the questions, the patient explains that in the specific case, which is a 21-year-old man, again, he has had a cough for 2 days and it's dry in nature with no sputum present. He's coughing frequently and it's keeping him up at night with a headache. He's currently a student, a non-smoker, and he drinks only occasionally. He needs to stay alert and focused to study for his final exam. So this is one of the things of the history that we gathered from our patient. He has no relevant medical history and has not taken any medicines or OTC treatment. So remember very well, it's a 21-year-old male. He has a cough for 2 days, dry in nature with no sputum. He's coughing frequently. It's keeping him up at night with a headache. And of course, he's a non-smoker. So now the question number 1, what is the patient diagnosis? What do you think? The option A is, since he has comorbidities, it's likely that he has a bacterial infection that needs to be treated on the spot with antibiotics. The option B, since he has no comorbidities or serious symptoms, it's likely that he has an acute viral upper respiratory tract infection that will resolve by itself in 3 to 4 weeks without antibiotics. Number C, since he has symptoms indicating a more serious condition, he needs to be referred on the spot to the doctor. And since he's a smoker and alcoholic, unfortunately, he needs to be referred to a rehab clinic. So I'll give you a little bit of time to think and use your precious heads to give us your answers. Yes, I'm going to click to see the answers and see your precious answers here in my screen. Here I have like 21% of the answers I mentioned A, 50% mentioned B, C 22%, and D is 6.1%. So the typical answer to this question is basically the majority answered it, which is I'm extremely proud to see that at least 50% of the attendees answered the question correctly, which is definitely the patient has no comorbidities or serious symptoms. It's likely that he has an acute viral infection, and definitely it will resolve on its own without antibiotics at all. So this is the problem when we don't understand the history of the patient well, and we go ahead and refer to the doctor because some of us are not courageous enough. Maybe we lack a little bit of confidence if we're not trained well as pharmacists to go ahead and say that just go ahead and refer to the physician. So we have to have a clinical judgment in order for us to recommend the most appropriate treatment for our patients. The second question is, what is your advice and recommendation? Number A, the patient is advised to take simple analgesia for the headache and pain associated with the cough, like 1 gram of paracetamol up to 4 times a day. B, the patient is advised to take a cough suppressant for the dry cough, like something containing natural ingredient. Number C, addition of caffeine can enhance the analgesic effect of paracetamol and help him stay alert. I don't know if you remember anything about that. Number D, he should be told to rest, drink plenty of fluid, avoid exercise, because this can trigger cough. He's still young. If the cough has not gone within 3 weeks, and if it changes in nature, probably, definitely if it becomes more productive or with phlegm, the patient should be advised to see their doctor or their physician for their further investigation. And of course, I will give you a little bit of time to think of the answers for the question number 2. And I hope that you will do well this time, and I will get 100% right answers from our lovely attendees. I'll be waiting impatiently. This one is not difficult, by the way, so you should be able to catch it. I didn't receive anything yet in the... Yes, now I'm receiving some answers related to the case. So I have 14% A, 20%, around 23B, 8% A, C, 18% D, and 37% all of the above. And I salute you, whoever answered D or E, which is all of the above. And this is basically all the approaches that we have to follow in order for us to treat this poor 21-year-old gentleman, because he has to take analgesia, he has a headache. He needs to concentrate and wake up for his and study for his exam, so we can add a little bit of pills that have caffeine to the Panadol or to the paracetamol. Of course, he's advised to take a cough suppressant because the cough is dry, and of course, he has to be told to rest and take plenty of fluid. So all of the above answers are correct. So don't worry, I'm still proud of you all. Now, the second case, I hope now you can probably focus a little bit more on the scenario. A patient with chronic cough that has lasted more than 8 weeks. This is a flag, maybe. A 42-year-old woman presents to the pharmacy with an ongoing cough that is going or causing her problems and would like to buy some cough medicine. So she's 42-year-old woman. It's been ongoing. The assessment is crucial here again. Please ask the patient about the cough characteristics, how long she has been having the cough, when did it start, is it the onset, was it gradual or sudden, is there any pain associated with the cough, like any type of chest pain, and of course, is the cough productive or dry in nature? Are there any type of red flag, for example, that we have to think of? If there is blood present in the phlegm, this is probably a red flag that we can investigate further. Is there variation in the cough? Is it better or worse at night? And is there anything that exacerbates the cough, makes it worse? Patient medical history, of course, we have to ask the patient, is she feeling any type of fever, temperature, runny nose, or malaise? Does she have any medical conditions? Is she currently taking any medicine, including OTC, including herbals as well? And has she been treated for recent infection? And has she had the flu jab this year, which is the flu vaccine? So these are important questions to gather. The social history, what does she do for a living? Does she have allergy? Does she have any pets at home? Again, the smoking history and the social history are crucial. The quality of life of the patient, for example, does the cough affect her quality of life? Is she able to complete her task, which is walking upstairs, as she had done prior to the cough starting? So anything affecting her quality of life. On answering the questions, I hope you focus very well with me that she's an office worker and has been smoking 20 cigarettes per day since the age of 15 and has a cough for the past 3 months. She has not wanted to bother her GP as the cough is persistent throughout the whole day and is dry in nature. She has been having pain in her ribs, but she feels she's only owing, or it's only owing to her coughing consistently. That's why she has pain. She has noticed recently that she has been feeling more breathless as in unable to walk up the hill to her house without stopping, like she did previously. She has also noticed that in the past couple weeks, there has been red blood spots on her tissue when she coughs. So we have to think together what is going on with our poor patient. The question is, which one of the following is correct? A, chronic cough is most prevalent in middle-aged women. Is it correct or no? Especially those who are having a significant smoking history, as the smoking effects are cumulative, usually. The patient has a chronic cough with several flag symptoms, which is hemoptysis, pain, shortness of breath, and should be referred urgently to her GP or respiratory specialist. When questioning a patient who presents with a chronic cough, it's not very important to determine the presence of a red flag symptoms, because we can do that in the pharmacy and give the appropriate treatment, or A and B are correct. So I will give you a little bit of time. Just think about it, squeeze your brain, and tell me what you think. I'm waiting impatiently for your answers. I hope you are voting, all of you. I think nothing received yet. Okay, I'll be ready to open if there is anything. Yes, it's coming. As if I'm receiving a gift here. I'm very happy that I'm opening the answers, and very happy to see that 62% of the attendees answered A and B, which is absolutely correct, which is definitely that the patient need to be referred, and the patient that has a chronic cough, it's very prevalent, most prevalent in middle-aged women, and definitely her smoking history is alarming. And definitely C is not correct at all, because it's very important to determine the presence of any red flag symptoms, usually as pharmacists. That's why we exist. What is your advice and recommendation? First, A, the patient is advised to book an urgent appointment with her GP, who likely will refer her to a specialist respiratory doctor. The patient should be sold a cough suppressant. This is number B. C, the presence of several red flag symptoms can indicate underlying conditions such as lung cancer. This, however, cannot be diagnosed on the spot without a physical examination. It's important to worry the patient and to express the urgency of further investigation. And E, A, and C are correct. What do you think? By the way, this is a very important case that we see a lot in practice, and This makes a difference between an alerted pharmacist who really is proactive and looks for solutions for patients and recommends the best treatment. So I'll give you a little bit of time to think. Okay, getting the answers now. And also, luckily, 74% of the attendees answered A and C correct, which is absolutely true. Definitely, I will not recommend a cough suppressant for this patient, because if you suppress the cough, you will not have any, or you will not benefit the patient at all, because you are suppressing something dangerous, and you want this cough to come out, and you need to recommend an appropriate treatment approach for her to be diagnosed as soon as possible. The last case will be case number 3. It's a cough in a child. It's a different perspective, different aspect, to just change the examples a little bit. You are a parent that brings, or there is a parent that brings her 4-year-old son to the pharmacy and asks to speak to the pharmacist because her son has a loud cough and a runny nose, both a loud cough and a runny nose. When questioning the parent about the child's cough, it's important to determine as well the nature of the cough and the impact it's having. Definitely there are areas to be discussed. When did the cough start? When the cough is it dry or productive? Has the child been feeling unwell recently? Like, has he have any aches, pain, sore throat, runny nose, or fever? Is there a wheeze associated with the cough? Is the child experiencing any stridor, any tachypnea, or swallowing difficulties? Because this is urgent, this is a red flag. And could this cough be aspiration of a foreign object, for example? So these questions we have to think of, although they take effort and they take time, but it helps a lot with the diagnosis and if we need to refer yes and no, or no. Patient medical history. Does the child have any medical issues? Are they currently taking any medicine? Is it their first presentation of the cough? How old is the child, and are they up to date with their vaccination? This is crucial as well to ask. And has the cough had an impact on the child well-being? For example, finger clubbing, any type of hypoxia, hemoptysis, or shortness of breath. So we need to ask all these questions. Upon answering the question, the parents explained that her son has been coughing for the past 3 days, mostly at night. It's a dry cough that sounds like a barking noise, and his voice is a bit hoarse. The child has no previous respiratory symptoms, nor has been hospitalized for any infection. He's up to date with the vaccination. On exam, the child looks well apart from a runny nose, and he does not have any temperature or shortness of breath, which is great. Now, my question to you, which one of the following is correct? First, the child most likely has a croup. This is this is a common bacterial illness in a child which causes a characteristic barking cough. The illness is self-limiting and will be improved by over-the-counter cough remedies. So increase our sales, we give them cough remedies, and we tell them to go home. And the number D is the illness is self-limiting and will be improved by antibiotics. So what do you think is the correct answer here? I hope you are focusing well with me, and I'm sure if you are focusing very well, you will be able to answer the question correctly, all of you. So I will give you a little bit of time. Okay, waiting impatiently again to open up my screen and see if I can see your lovely answers. Here I can see some type of variation in the answers, and I see that 36% only answered the question correctly, which is the child most likely has a croup. And definitely when you answered the B, it says common bacterial illness. This is a viral illness, not a bacterial illness, and this was the trick here. And the illness will not be improved by over-the-counter. Definitely, it will not be improved by antibiotics as well. So definitely the child has a croup, because these are characteristics of a croup that we discussed in my presentation previously. Now, the second question, maybe you could answer it also, think about it more, which is what is your advice and recommendation for this parent? Their child, number A, their child's symptoms should improve within 48 hours, and that he should be well in a week. Number B, the parent is advised to check on the child regularly, including through the night, to see if there is any type of shortness of breath, any type, the presence of, for example, cyanosis on the lips, the shortness or decrease in oxygen saturation. This could be a very important point to say or to tell or to aware the parent of, to check the child at night. Number C, which is it's recommended to give the child plenty of fluid, but that the illness will not be improved by over-the-counter cough remedies or antibiotic. If the child is struggling to breathe, their skin or lips look blue or gray, or they are unusually quiet or still, definitely we have to call emergency for a better approach. So number E is all of the above are correct answers. So I would like to wait also to see what is your answer for this question, and what is your advice and recommendation. Okay, so what do you think here? I'm opening the answers. Yep, about 70% answered the question correctly, which is definitely I'm very proud of. The symptoms should improve a little bit. The parent should check the child definitely at night to check for any symptoms of shortness of breath or cyanosis or presence of bluishness on the skin and the lips. And of course, it's recommended to give the child plenty of fluid and to let them